Now, tonight we're also getting new information about just how long the coronavirus may have been silently spreading in the United States.
You're right, Devin. Health officials in California now say the first U.S. coronavirus deaths actually occurred weeks before previously thought. Our Dr. Frank McGeorge joins us live to break down the new timeline. And Frank, I guess this comes as no surprise to doctors.
No, not at all. In fact, many doctors, myself included, had patients earlier on that we believed were COVID-19 cases, but they didn't qualify for testing because they either didn't have a history of travel to China or they didn't have the required symptoms for testing of fever, cough, and shortness of breath. But now there is concrete proof that the timeline of cases actually started much earlier.
The first confirmed case of coronavirus in the United States came on January 21st in a man from Washington state who developed symptoms after returning from a trip to Wuhan, China. But the first confirmed U.S. death was thought to be more than a month later, on February 29th in Kirkland, Washington. Health officials there later found 2 deaths on February 26th were also due to the virus, pushing the timeline back 3 days. But coroners across the country are now looking back at other deaths. The medical examiner in Santa Clara County, California, sent tissue samples collected during autopsies performed in February to the CDC for testing. Samples taken from patients who died at home on February 6th and 17th both tested positive for the coronavirus. That pushes the fatality timeline back 20 days. Health officials believe the patients were infected in the community. Neither is known to have had a travel history. Given that deaths tend to lag infections by about 2 weeks, the first patient could have been infected in mid-January. It's now likely that the coronavirus was already spreading in the U.S. far earlier than reported, hidden in a bad flu season and undetected by rigid testing rules.
Yeah, and as one health official described it, COVID-19 deaths really just represent the tip of the iceberg in terms of total infections. For every death, there could be 50 to 100 infections in the community or more. And because of the limited testing that has been done, we don't know how big that iceberg is, but we know for certain that it did strike us weeks earlier than previously thought.
So are you saying that you think this timeline could shift even farther back as more deaths are reviewed, Doc?
Well, yeah, as the whole situation unfolds, I think that is absolutely possible, and it might turn out that many more people who were thought to have the flu or some other virus in January and February may have actually had COVID-19. Now, that's, of course, much more difficult to determine, but it could have an impact on how many people ultimately have some antibodies against this virus moving forward, because they may have been unknowingly infected in those early days.
Right. I know a lot of people are wondering that exact same thing. Okay. Thanks, Doc.